Children under 12 have been banned from public places during Malaysia's COVID-19 lockdown. Health experts are warning mental health issues could arise because of the long-term confinement. Melissa Goh with this report.
Evelyn Tan's baby boy was born when Malaysia was under the strictest lockdown last year to battle the pandemic. It wasn't easy for her, she said. She couldn't go to the hospital without having to worry about getting infected. But both her and her husband's anxiety melted away when their baby arrived. Now nearly 1 year old, she lamented that her son has never been anywhere since the day he's born, except to the hospital to receive his regular jabs and medical checks.
It has been a very difficult time for us seeing the news and all the cases been rising day by day. For my little boy and also the rest of the babies which is born on 2020, 2021, they doesn't have the chance to see how beautiful the world is.
Lydia Hamdan too feels the same way. The mother of two said her children have been missing out so much the past year.
My first child tak boleh pergi sekolah, cannot play with other kids, cannot mingle with friends.
Lydia, who's with the local telecommunication company, said at least she now works from home. She can keep an eye on her children and make sure they are safe.
I can see my child growing up in front of me, and I pun rasa selamat diorang dah ada berada di rumah bersama saya.
Malaysia has reported more than 80,000 confirmed cases involving minors, and more than half of them are below the age of 12.
Kalau macam diorang dah positif, duduk seorang-seorang kat hospital, macam mana? Kesian kan? Stay alone dengan orang lain yang tak kenal. So kita jangan ambil risiko.
Now, generally, children don't get too ill from COVID-19, but increasingly, some have ended up in ICU and 6 have died so far, prompting the Ministry of Health asking parents not to bring children to public places. So Lydia and Evelyn know that staying home is the best way to protect their kids. Now, with school closed and children confined to their homes 24/7, mental health experts have warned of serious long-term issues for children.
Children are constantly confined to their homes, feeling like captives. They can no longer meet their friends and even their extended family members. All these factors can cause children to experience chronic stress, anxiety, depression, and even PTSD, which can accompany them as they enter adulthood.
A routine, she said, is key. Coupled with regular exercises would go a long way towards surviving the pandemic. And for these children, many would be hoping that this would be the final lockdown and life can return to some normalcy soon. Melissa Goh, CNA, Kuala Lumpur.